My name is Dr. Mairead Masuda. I am the naturopathic doctor here at JWP in Enliven Aesthetics. And today we're going to talk about PCOS, or Polycystic Ovarian Syndrome. So we'll have time at the end for any questions that you might have. You can put them in the chat. Just let us know. So here, let's go. Oh, hold on one second. There we go. So symptoms that often flag for investigation of PCOS are mainly, let's see. Oh, hold on a second. We have someone raising their hand. Does that mean that there is an issue? Can we put it in the chat? Let me know. It's probably the easiest. Okay. Yeah, if there's any issues, just put it in the chat, or, anyone has my number, just text me. Okay, so symptoms that often flag for investigation of PCOS are things like acne. Someone's had acne for a while, they have it along their jaw, they can't figure out what's causing it. Maybe they've been having irregular periods for a long time, or very heavy cycles, or they're trying to get pregnant, they've been having trouble conceiving. Or they had some lab testing done, they saw that they have high testosterone, or they have some excessive hair growth. These are things that there are many other symptoms that show up from PCOS, but those are usually the ones that trigger someone to go to the doctor and be like, what's going on? Something doesn't feel right. So what is the diagnostic criteria for PCOS? So you have to have at least two of the following, and one of them has to be hyperandrogenism. And so hyperandrogenism is usually caught, either through clinical evidence, like I said here, you might have acne along the jawline, you might have excessive hair growth, or through lab work, such as, finding high androgens like testosterone, maybe DHEA, and a few other ones. The other criteria are oligomenorrhea. So that's having infrequent menstrual cycles. And I hear it a lot that people say, oh, I regularly irregular, which means very often I will go maybe 3 months between cycles, between periods. Maybe it's every other month or something like that. And then lastly, polycystic ovaries, which is what it's named after. And you'll find this on ultrasound. But funnily enough, you actually don't need to have polycystic ovaries to be diagnosed with PCOS. So what are androgens? Because these are, you must fulfill this criteria to be diagnosed with PCOS. So androgens are hormones like testosterone, androstenedione, DHEA, like I mentioned, and women need androgens. We think of testosterone as this male hormone, and of course they have higher levels, but we still need testosterone. We produce it from our ovaries, our adrenal glands, and also our fat cells, which makes sense because, as you'll see later on in this presentation, reducing fat and losing weight can actually help improve the symptoms of PCOS. So why do we need these androgens? So we need them to stimulate puberty. We need them for estrogen synthesis. They're really important for sexual desire and satisfaction, and also prevention of bone loss. So while we might not need as much as men, we still need some. So there are different drivers behind PCOS. And I like this little graph because you can, if you have any of these symptoms, you can just go down the line. And I'm going to be talking about all these different types of PCOS and the different root causes of PCOS. Is it insulin resistant? Is it because you were on birth control for a long time? Is it due to inflammation, which a lot of us have in some way or another? Is it a genetic adrenal cause? And there are other hidden causes, like you can see at the bottom, that we will investigate through thorough history and lab work. But let's get started with the different kinds. So insulin-resistant PCOS. What we see when there is increased insulin is that androgens also go up. And you'll notice this, like you can see in the picture, people have acne, especially along the jawline, excessive hair growth in places they don't want, usually dark, coarse hair. You can also have male pattern balding in women, and just along the top, as you can see in that picture. And these are usually, like I said, these are the signs that cause people to come into the doctor and try and figure out, what is going on. In addition, when you have increased insulin, this can cause impaired ovulation. So like I mentioned before, a lot of people who are trying to investigate what is going on have been having trouble conceiving, or they've been having the irregular cycles. And this is happening because you have a switch. When you have that increased insulin, you have a switch from estrogen to testosterone. In addition, you have your pituitary in your brain is causing you to, it's releasing more luteinizing hormone, which again, that's going to cause you to have higher androgens. It's going to increase your testosterone, your DHEA, your androstenedione. And then lastly, it also decreases your sex hormone binding globulin, or your SHBG, because that's a mouthful. And what that does is it's exactly what it says on the tin. It binds sex hormones. It's a protein that binds sex hormones. So if you're lowering that, then you have more free testosterone to flow through your body and act on different tissues. So what are some potential causes of insulin resistance? So we know that smoking, alcohol, hormonal birth control can contribute, stress, sleep deprivation, even imbalancing the gut microbiome, environmental toxins, and like vitamin deficiencies. These can all lead to insulin resistance. And of course, you want to improve insulin resistance no matter what, but for women who are dealing with PCOS, this is very, very important. Okay, so the second type of PCOS. One question you want to ask is, if you were on birth control, before you went on, were your periods normal? If you say yes, then it's likely that you have post-pill PCOS. And it's actually very common to experience a temporary surge in androgens when you've been on an androgen suppressing birth control. So this is enough to qualify for post-pill PCOS. So that's something always to investigate, something to ask about as a provider. Have you been on birth control, and which one have you been on? If you say your periods were not normal before the pill, then you move on to the next one, which is a big one. It's inflammation. So like I said, most of us have some form of inflammation, and it's hard to get away from. We have our genetic factors, but more importantly, we have environmental factors. We have environmental toxins that are hard to get away from. I always like to tell my patients, like, unless you're going to be going completely off the grid and into the wilderness, and you're growing your own food, and you're living by yourself, and you're not around any, EMFs and all that kind of stuff, it's really hard to get away from environmental toxins. And the best we can do is support our body in detoxing them. But all these things, our diet and everything like that, promote inflammation. And chronic inflammation can actually stimulate the ovaries to make too much testosterone. And that's a contributing factor to every type of PCOS. So if I'm talking to a patient, I'm wondering, okay, I wonder if it's an inflammatory cause. First, we need to figure out, do they meet the criteria? Do they have those elevated androgens? Do they have insulin resistance? Do they have, hold on. Sorry, guys, I'm bad at presentations. Let me go back. Do they have insulin resistance? Were they on birth control? And then if not, do they have signs and symptoms of inflammation? So some signs and symptoms of inflammation, and I bet all of us have at least one of these, unexplained fatigue, some kind of bowel problem, do they have small intestinal bacterial overgrowth on lab work? Do they have any autoimmune diseases like Hashimoto's, or rheumatoid arthritis? Do they get headaches, unexplained headaches that can't be explained by structural issues? Do they have joint pain? Again, that's not explained by working out too hard. And then many people will have a chronic skin condition like eczema, psoriasis, or some kind of histamine issue, and they get hives. So the treatment for inflammatory PCOS is always to identify and correct the underlying source of the inflammation. This could be, avoiding a food sensitivity. It could be fixing an underlying gut issue, or addressing, chronic mast cell activation or histamine intolerance, which you want to do no matter what, but very helpful if you have PCOS. Okay, next type, adrenal PCOS. So remember we were talking about the different types of androgens, androstenedione, testosterone, DHT, and also DHEA. People get diagnosed with adrenal PCOS if they have normal ovarian androgens, such as testosterone and androstenedione, but they have elevated DHEA. This can be due to genetic upregulation of the specific adrenal androgen. And so what you'll usually see with these patients is that they have elevated DHEA and they actually have normal ovulation. And when, there's a few things that you want to rule out when you see this picture. You want to check for high prolactin. If they have high prolactin, you want to get to the bottom of why that's occurring. That can be due to certain medications. It can be due to stress or certain types of excessive exercise, hypothyroidism, like an underactive thyroid. And if it's extremely high prolactin, then we'd be looking at it, looking out for a tumor. But you want to rule that out. Other things you want to rule out is something called adrenal hyperplasia. And this is usually looking similar to adrenal PCOS if it's late onset. So like late onset congenital adrenal hyperplasia, another mouthful. And this is, again, it's due to a group of autosomal recessive disorders. And usually it's going to look similar to this because they have reduced cortisol synthesis. And then other things you want to look up for, especially with elevated DHEA, is an abnormal stress response or HPA axis dysfunction. HPA axis dysfunction is when your hypothalamus, your pituitary, and your brain, they talk to your adrenal glands and they talk to each other. They're telling each other, okay, we need you to secrete more stress hormone or less stress hormone. And when there's dysfunction there, which often happens in our stressful lives, this can cause elevated DHEA, and you can fall under this category of adrenal PCOS. And then lastly, there are some hidden drivers of PCOS. These are all things that if you have a good provider, they're going to do a really thorough history, and they're going to talk about all these things. Do some lab testing, find out, do you have any thyroid disease? Do you have any family history of that? Any vitamin D deficiency, zinc deficiency, iodine, because that's going to contribute to thyroid disease. Again, the elevated prolactin, they're going to look into that. And also if you have low calorie intake, because when we do these extreme diets, we have very low calorie intake, this causes stress on our body. For some people, this works really well. For others, this stress can actually cause changes to our genetics that, like I said on the previous page, can cause issues with elevated DHEA, which can contribute to PCOS. So this is something to look out for, and hopefully you have a really good provider who's going to look at these things and examine it if these are possible hidden drivers of your PCOS. Okay, I want to go back. So just before we go on to what we can do, if you have more than one type of PCOS, the way that I listed these were in order of priority. So if you have insulin resistance, then you have insulin resistant PCOS, even if you have inflammation, even if you've been on birth control and it's worsening those symptoms. So insulin resistance is always the first thing we want to take care of, looking at our blood sugar. So what can we do? There are so many ways that we can address PCOS, and no matter what is driving it. So first, lifestyle. Now, I know that you've heard of our adipose tissue, our fat cells, but we have white and brown fat cells. So there's two types of fat, like I said. Brown is much more metabolically active. We have a lot more of that when we're a baby. They have a little fat pad on their back. Much more metabolically active, and it burns calories even while you're at rest. So women with PCOS seem to have less, and it explains the trouble that women have losing weight when they have PCOS, and why even lean women with PCOS tend to burn protein instead of fat while they're sleeping. So some ways to increase brown fat is high intensity training, HIIT workouts, circuit training, biking. And I have to still an aside though, don't over-exercise, because over-exercising can then be a stressor which worsens PCOS. So it's about finding that balance. Other ways to increase brown fat are cold showers. They're not the most fun, but I promise you start to like them. You can start by just at the end of your shower doing 10 to 20 seconds of cold, and I promise you you'll start to really enjoy them. Getting really good restful sleep. It's so important for, I mean, so many different processes, but to have that rest and digest time, very, very important for balancing our hormones, balancing our blood sugar. So always important no matter what. Having healthy thyroid function, making sure that your T3, which is your active thyroid hormone, is at a healthy level, because that actually increases your brown adipose tissue. And then lastly, you do want to reduce your body fat if your BMI is over 25, because like I said at the beginning, our fat cells actually produce androgens, and that's our goal, is to reduce those androgens. Okay, with food. I know I put this all in capitals because it's so important, balancing our blood sugar. When we balance our blood sugar, we're reducing inflammation, we're reversing insulin resistance. And ways to do that are with adaptogens. Like, you know, there's so many adaptogens out there, and some are better for certain people, depending on what their sleep is like, you know, what their mental emotional health is like. So, you know, we always prescribe those depending on the individual patient, but adaptogens can help balance blood sugar. In addition, it's going to help manage your cortisol, your stress hormone, which, like I said, I talked before about how increasing that stress can throw off your HPA axis. So that is the first thing, always balance your blood sugar. And ways to do that, you want to reduce those fast carbohydrates. So, you know, having heavy, high carb meals like with pasta and rice and white bread and things like that. Those are fast carbohydrates, and they're really great for certain things. But to balance your blood sugar, you want something that's going to give you a much more prolonged, sustained release. You don't want this increase in blood sugar and then a quick drop down. You want a more sustained blood sugar, such as with sweet potatoes, things like that. Another thing you want to do is increase your protein and healthy fats. And research has shown that even just a moderate reduction in the amount of fast carbohydrates you're having and moderate increase in protein and healthy fats has shown to help balance blood sugar. So even just that, you don't have to go crazy with it, but even just a moderate reduction, like I said, in the fast carbs and increase that protein, healthy fats can help. Second, an anti-inflammatory diet. Basically removing all those high inflammatory things like fried foods, processed foods, trans fats. All those things cause inflammation in your body. And again, like I said on one of the previous slides, inflammation is a driver behind like every type of PCOS. Another thing that you can do is eat omega-3 rich fish. This helps to reduce insulin resistance. It helps to reduce inflammation. It's great for skin integrity. So lots of extra things, but for this talk, it's helpful for reducing insulin resistance and inflammation. Another thing you can do is incorporating flaxseed. Flaxseed helps to lengthen the luteal phase, which is the second phase of your menstrual cycle, which helps to improve ovulation and reduce testosterone. So that's ultimately going to help with fertility. Sesame seeds, they help reduce elevated androgens by improving DHEA, and also the SHBG, the sex hormone binding globulin levels, which contribute to the adrenal PCOS. And then lastly, legumes. So, you know, your chickpeas, your kidney beans, lentils, things like that. Those are rich in inositol, which helps to improve insulin resistance, you know, reduces testosterone. It's very helpful for people who are having trouble conceiving. And in addition, is also helpful for anxiety. So it's just keep eating those legumes. Okay, another thing we want to support is mind-body. So we want to support our HPA axis, and this is something that I talked about previously with your hypothalamus, your pituitary, your adrenal glands. They all talk to each other. We want to give them the support that they need to function optimally. And you know, ways to do that are you know, connecting with other people, having a meditative practice, or mindfulness practice, whether that's journaling or, they have different support groups, walking with friends, and things like that. There's lots of different meditation apps and YouTube videos. Finding one that suits you, that really resonates with you and is something that you're going to keep up with is really important. And then another thing is to try to be patient with yourself, because it can take a long time. It can take, I would give about 3 to 12 months to return to cycle regularity, and then regular ovulation and fertility, and even the hair loss that you can have with PCOS. It takes a little while. So being patient with yourself, being kind to yourself, because this is a process and everything you're doing is helping improve your health. And then lastly, prioritizing sleep, always important. I stressed that before, for so many different functions, but especially with hormone metabolism, hormone production. Okay, so some of the different nutrients that I was talking about earlier. Inositol, really helpful for regulating ovulation, improving fertility, helps reduce, it helps reduce testosterone, and it helps reduce anxiety. Vitamin D, something that you want to get checked with your doctor to see what level you're at. It plays a huge role in immune health and energy and mood, but research has shown that even when you're not deficient, having a vitamin D supplement can be very helpful for all the PCOS symptoms, especially helping with fertility. Omega-3 fatty acids I already talked about. They're just wonderful for so many different things. NAC, N-acetylcysteine, is an amino acid, also very helpful for improving ovulation, improving progesterone levels, and also with that L-carnitine, melatonin, ALA. Those are all very good for fertility for the people who are having issues with reduced ovulation or cycle irregularity. Those are all very helpful. And I included a couple of my favorite botanicals for PCOS, which is white peony and Vitex. Again, very helpful for improving ovulation, helpful for fertility, reducing testosterone, and all those things. So what are the next steps? Have you been listening to this and you're saying, okay, this is me. I've had those labs, or I feel that way, or this has happened to me. Next steps, you want to find a provider. First of all, find a provider who's going to listen to you, listen to all your symptoms and take you seriously, and not brush you off. Because I hear about this all the time. My patients are brushed off and like, yeah, try this birth control, which I love birth control and I'm so glad it exists, but it's not, it's a Band-Aid in these types of situations. So find someone who's going to listen to you, and take all your symptoms seriously, and then order the appropriate lab testing. Very important to do a thorough history so you know exactly what kind of lab testing to do. Do you have a family history of thyroid disease? Do you have a family history of any kind of elevated testosterone? Like, does this run in your family? Do you have vitamin D deficiency? What about your gut function? Do you have any dysfunction there? Bacterial overgrowth or candida or things like that. And I say and more on this list just because there are so many different things that we could check for. And that's why it's so important to have that provider who's going to take the time to listen to you and really pay attention to your symptoms and order the appropriate lab testing. So take home message. I don't know how long I've been talking for, probably too long, but take home message. You want to find the root cause. That's why it's so important to find that good provider who's going to order the right lab testing for you, get to the root cause of it. That's something that we do here. We have a PCOS panel that we order, and we'll add on anything, after a history. If I hear they're really having issues with bowel movements and they're not regular, or they're loose, or they've been taking antibiotics, I will, run a gut function panel. Have they been exposed to a lot of environmental toxins or mold? Those are really important to listen to and then test. Second point, reduce inflammation. And like I said, that's for everyone. Everyone could do with reducing inflammation. It'll be helpful no matter what, but especially in people who have PCOS. And number one, when you find out you have PCOS, is balancing blood sugar and your insulin sensitivity. You want to reduce stress. Again, this is for everybody, but really important with PCOS. Any way that you find that is helpful for yourself, something that you can sustain, whether it's a mindfulness practice, whether it's a certain type of exercise, or prayer, or spending time with family, anything like that, that is something sustainable for you. Optimize sleep. Again, this is general stuff, but it's really, really important. Support your gut health. A lot of things start in the gut, and once we heal that, there's usually a trickle down effect. And like I said, lastly, reduce environmental toxin exposure or help open up our detoxification pathways. Again, very important, but especially if you're trying to get pregnant, really important in the fertility path to make sure that you have reduced that burden before you get pregnant. And it helps with fertility, it helps for your pregnancy and for after and the health of your baby. So that is everything that I have. I think I have a few questions in the chat already. Let's see. Okay, so post-pill PCOS, usually after estrogen birth control, but also after progestin. Yeah, so anything that's basically messing with our hormonal levels, which is why, like I said, I'm so happy that birth control exists and that we have the option to have it. And sometimes, and a lot of times it is prescribed for women who have been found to have PCOS. They'll be prescribed birth control, and it can help with symptoms, but it's not a long-term solution. And usually once they stop, they'll have the same, if not worse, symptoms show up again. So any type of birth control that's going to be changing your hormones, you can have this post-pill PCOS show up as the androgens increase. Yes, sauna is also good for increasing brown fat. Sauna is good for so many things, for detoxification, for reducing inflammation. Yes, sauna can be helpful for that. Let's see. And yeah, so like I mentioned before, oh, let's see. Okay, so like I mentioned before, we do have a panel here that is specifically for PCOS. It's the general panel, looking at your different sex hormones, looking at insulin, and things like that. And when we meet, we would talk about any other potential drivers behind the PCOS or behind your symptoms, and we would investigate that further. So yeah, you can come here to JWP and we will help you with that. Let's see. You say eat legumes. Yeah, so, okay, yeah, eating legumes, very important. Non-GMO, also very important because, organic as well. Because again, one of the other things that I talked about was environmental toxin exposure, and that can wreak havoc on our hormones. So it is, as much as possible, because I know that not everybody has access to organic non-GMO food. So we're all doing the best that we can. Yes, legumes are very important for helping out with your hormones, but having that balance between, can I afford to get really organic, pesticide-free, non-GMO legumes with your other symptoms, because there are other ways to help support your hormones as well. But yeah, like I said, when possible, absolutely. Let's see. And then let's see. So one of the questions was, can you have PCOS without high androgens? And that is actually the one thing, like out of the 3 criteria, you must have high androgens on your on lab testing or showing symptoms of high androgens. That's the one thing that must qualify you for PCOS. Can you not have high androgens and still have some of these symptoms of PCOS? Absolutely. But then again, we would be looking for other root causes, and you wouldn't necessarily be falling under the heading of PCOS, but it can have some of the same symptoms as well. So that's why, like I said, very important to work with us, work with someone like me, or someone who is going to really investigate the trigger behind it. And let's see, yes, it is possible to have PCOS without insulin issues, but that is one of the the main types of PCOS is the insulin resistant PCOS. And that just takes precedence because it's so common here with the standard American diet. And so many people have some form of metabolic issues. So it's just more common, but yet you can have it without having insulin resistance. Let's see, is it a good idea to test for women who are not trying to get pregnant? Absolutely, because, you know, like I said, of course, this is very important for people who are trying to conceive, but many times people are going to their provider because they're having issues, even without trying to conceive, they're having issues with acne, excessive hair growth, maybe male pattern hair loss, they're having trouble losing weight, and things like that. So definitely, even if you aren't trying to get pregnant, it's something that if you're having any of these symptoms, like I said at the very beginning, if I can go all the way back, anything that's showing up on this first, yeah, anything like that, you know, low sex drive, trouble, you know, changing your weight, irregular cycles, especially irregular cycles. If you're having irregular cycles, it is really, really important to figure out why, because it's like another vital sign. We have, you know, we check our blood pressure, we check our temperature, things like that, but it's another, for women, it's another vital sign. If we're not having regular cycles, and if we're having excessive bleeding or not much bleeding, or if we're having really extreme cramping, or mood swings that is affecting our life, that might be typical with women, but it's not normal. And we've been told for a long time, yeah, it's normal, you know, it's PMS, but it's not. Our bodies are going through changes at that time, hormonal fluctuations. So we should notice something, but it should not be affecting our day. We should not have to take time out of our day or not do certain things because we feel so bad. That's not normal and shouldn't be the norm. So if you are experiencing anything like that, please do come to us, go to a trusted provider, and have them investigate further, because you deserve to figure out why you're feeling like that. You should be able to function in your day-to-day without issue. I think, let me see. So, I'm not sure of the exact number, but it's super common to actually see PCOS in people without actually having the polycystic ovaries. When you see on the ultrasound, let me see, I have a little picture of it. Yeah, right there. It's actually very common. And I think they used to think that it was just with people who were showing up having these polycystic ovaries. But now, like I said, that's not even the main criteria for PCOS. It's that those elevated androgens, the testosterone, the DHEA, the androstenedione. So pretty common. Let's see. I think I answered all the questions. If anyone else has any other questions, just let us know. You can keep writing to the chat. But if not, we're always here. We're always here for you, to take a thorough history, to do the appropriate lab testing, and to get to the root cause of your symptoms. So please don't hesitate to contact us. We're all here, happy to help. A bunch of ladies here, so some might be able to relate. And just know that you deserve to feel good. You deserve to be able to function in your day-to-day life without excessive pain or, bad cramping, major mood swings, inability to lose weight, anything like that should be investigated, and we're always here to help. So if you have any other questions, feel free to call us, set up a consultation, or if you are about to write into the chat, just let me know. Okay.